Multiple sclerosis is a disease that affects over 2.3 million people worldwide. It's had a big impact on my life. Growing up, my father had MS, but there were no FDA-approved treatments. I believe it's so important to connect people living with MS to the resources they need. That's why I've partnered with Genzyme to help people living with relapsing MS learn more about taking positive steps in their lives. I'm actress Madeleine Stowe. Join me as we take action on MS. Hello, and welcome to Take Action on MS, a series for people living with MS, sponsored by Genzyme. Hearing your doctor say you have relapsing MS is a life-altering experience. You're left with so many questions. What does this mean for my future? How will I handle this? In today's episode, we're talking about taking action to keep things in perspective after you've received a diagnosis. I'll be speaking with retired MS nurse Beverly Layton, who has some great tips for how to take the first steps in your relapsing MS journey. But first, meet Leslie, an MS ambassador who was diagnosed with relapsing MS in 2009. A world traveler, Leslie felt like her diagnosis was going to get in the way of everything she loved. She even avoided treatment. But soon, Leslie would learn that she could take action.
Inspiration is like bathing. It's something you have to do every day. Because inspiration doesn't last, bathing doesn't last, so you have to do it constantly. Hi, my name is Leslie Ferrier. I'm married for almost 25 years to my husband, Jim. I'm the head of human resources for an international restaurant company, and I oversee almost 3,300 employees nationwide in 8 states. I sit on the board of directors for Liberty Humane Society in Jersey City, New Jersey, and I'm a kitten raiser for the Monmouth County SPCA. Sweet Potato is our Rottweiler Shepherd mix. She was a stray, and we found her, my husband found her in the street, and it was very near Thanksgiving. And she was such a sweet dog, I just called her a Sweet Potato, and it stuck. I was hospitalized back in 2009. They thought I had had a stroke because I was having trouble with my right side. And they had done a variety of tests, and I was in the hospital for a few days. And one morning, the doctor came into my hospital room, and he just looked at me, and he said, "So what drug do you want to take?" And I looked at him just confused, like, what drug for what? And he looked at me, and he said, "Oh, you have MS." He didn't even say multiple sclerosis. He just said MS, assuming I knew what it was. And that's how I found out. My body had essentially attacked me, and I had taken great care of it my whole life. I was in a ballet company for 18 years. I was captain of the track team. I was captain of the softball team. I ran at 5 a.m. every day. I never smoked a cigarette. I didn't drink. I had done everything right. And my body had just betrayed me in this unconscionable way. So it changed everything. And I just literally remember the air being sucked out of the room and thinking, my life is over, my career's over, everything's over. Being diagnosed with MS changed all of that, because it really, in the beginning, I didn't know what to do. I was lost. I was crying all the time. I'm not a crier. And I didn't have any control of this situation. I wanted really nothing to do with multiple sclerosis at that point. And my husband started doing some digging and researching, and he found an event on one of the medications that was available at a local hospital. And we went to that event, and I remember sitting in the room thinking that I was such a foreigner in this space and was incredibly uncomfortable. And the medical professional who stood up in front of the room proceeded to tell me that my relapsing remitting MS was going to develop into progressive MS, and that my brain was going to end up Swiss cheese. And when I heard that, I jumped up in that event, and I just basically ran out of there. Fortunately, at that event, I was introduced to the head of the MS Society in New Jersey. She came up to me and I said, you know, I only want to know one piece of information from you. Who's the best physician in the state of New Jersey for multiple sclerosis? And she gave me her name. And I went to see her, and that's where my education for MS started, my real education. She listened to every detail of what had happened and transpired up to that point. And the first thing she said to me is, "Your life isn't over. I'm your partner in all of this. We're going to help you to deal with everything that comes your way regarding multiple sclerosis." Back in 2009, when I was first diagnosed, there was only one way to deliver medication. That was via needle, and I hate needles. I passionately hate injections, anything having to do with a needle. I can sit here and talk about needles and make myself faint. That's how terrified of needles I am. I almost felt when I got the oral medication that I wasn't a sick person anymore. I associate needles with sick people. Multiple sclerosis really makes you think about this finite amount of energy you have and what you're going to spend it on. So you really start to prioritize your life better around what you truly want to spend your time and energy on and what's worthy of the minimal or the minimized amount of energy that you have. I started eliminating things and people that caused me a lot of stress. I started taking care of myself better to increase the amount of energy that I had available to me, and I started spoiling myself more. And I really put myself on a schedule on my bucket list. And one of the major items on my bucket list is traveling the world. And I was gonna walk. I was gonna walk the world. I wasn't gonna be in a wheelchair. I wasn't gonna be in a walker. I was going to walk. And everything has been expedited since I've been diagnosed with MS. There are a variety of activities that keep things in perspective for me, and I think that the traveling, the exercise, working, all those things keep multiple sclerosis in check for me because they're normal. I will not be dictated in my life about what I do and how I do them and why I need to do something. Oh, you have MS, you need to do this now. No, that's not how I live. I want to have these activities that I love, that I embrace, that I've always done. They contribute to the normalcy of my life, and they just happen to help support my health and wellness overall, not just because of multiple sclerosis. It's very easy to feed yourself negativity, and I'm one of those people that believe whatever you feed yourself, you're gonna bring to fruition. So I believe in really telling myself you can do it, not babying myself, really thinking of inspiring women who have gone through a lot of things and what they did. You have to just tell yourself you can do it. And I really think that courage is it's not the absence of fear. It's really just doing what you want to do in the face of your fear. Time is limited. It's later than you think. And there's things that you want to do in your life. So you better go do them now, rather than, oh, when this situation is better, when I have more money, when I have more time. All those types of things that we tell ourselves to not do something we want to do or to make an excuse. Multiple sclerosis for me has taken a lot of excuses off the table. You're allowed to mourn. You're allowed to mourn the body that's gone. You're allowed to mourn the life that's gone. And then when you're done mourning, buck up and figure it out. And there are people out there to help you. You need to get a team together of people that are gonna help you deal with it and contribute positively to your health and your wellness, and find the medical professional that's gonna be your partner in this crime, and the people around you. Whatever this disease has in store, you have a huge impact to the outcome. And don't forget that. I forgot that in the beginning, and I wish somebody would have said to me, hey, you have impact here. You can direct this. You have control in this situation to a certain degree. You are stronger than you think. You're more capable than you know, and you can master this. And don't give up.
Thank you, Leslie, for sharing your story with us. Keeping life in perspective after receiving your diagnosis isn't easy. You may get discouraged when you find negative feelings creeping in, but remember that this is a journey, and feeling down can be a natural part of it. I sat down with Beverly Layton to talk more about the challenges that come with receiving a diagnosis and how to keep it all in perspective. long have you been a nurse?
Well, I've been an active nurse for about 35 and a half years. I did decide to go ahead and take retirement from my institution last year, and I'm still very much involved in multiple sclerosis nursing.
Beverly, can you tell us what are the most common feelings people deal with when they've been diagnosed?
Well, I think one of the things that we have to say is this is one of the most life-altering diagnoses that we can give an individual. I think many times there are a lot of feelings and that are very common characteristics that our patients and their loved ones go through. The whole loss of control, the fact that unfortunately, we're diagnosing them with a chronic illness. We don't have a cure. We can't predict what's going to happen down the road for these individuals. I think that other things that we see with our patients is there can be grief, that sense of the immediate loss, but also them thinking about the future and what they may be a perceived loss at that time. I think that many times we can see anger come out, that disbelief, why is this happening to me? And I think that many times what we can see is there can be guilt, not only for the person with MS, but for those family members and significant others, that why is this happening to this individual? Is it something that we may have done? But then I think that many times there can be relief, because for some of these patients, it can be a very difficult diagnosis. They may have had symptoms for a number of years. They may have actually sought out care from maybe their internist or their neurologist, but finally they're being able to be told, this is what the situation is and this is what our plan would be.
Why can it be a challenge keeping things in perspective when you've been diagnosed with relapsing MS?
I think one of the things that we see, especially early after the diagnosis, is that we see patients who think that every time something changes or a new symptom occurs, it's directly related to their MS. We really like folks to have a good wellness approach. I think that as part of that clinical team, you also need to have an internist, family practice, nurse practitioner, look at those things that aren't directly related to multiple sclerosis and just be very proactive in what you're able to do for yourself.
What kind of support or resources are out there for people who are newly diagnosed?
So there are different associations that are in the community that have really based their life work on helping individuals and those affected by multiple sclerosis. I think we have to kind of take with a grain of salt, though, what you read on the internet. You've got to be so careful about so many of those sites.
What advice would you give someone who was recently diagnosed?
I think that knowledge is power. I think that looking at great resources that they can get information for themselves and their family members is so important. I think matching oneself up with the appropriate healthcare team is so important. And, that's always a tough question when I'm doing patient group meetings and things like that, when they're looking maybe for some advice as to what to do or how to better communicate with that healthcare team. And, not everyone's going to be on the same page. And I think it's so important, especially when we're looking at this, again, as a marathon and not a sprint, that you're matched up with a group of folks that you feel comfortable as to what is happening.
How do you encourage people with MS to take action after receiving their diagnosis?
One of the things that I like to encourage my patients to do is they're getting ready for their clinic visits, do a little bit of homework. I think that, getting a journal or making notes of what's going on, maybe since their last visit, it may have been 6 months since we last saw them, but also bringing a list of maybe the top 3 things that they want to make sure that they cover. I think it's also very important that an individual bring that second set of ears, whether it be a family member, a significant other, possibly even a friend. Because I think it's so important that, especially if there's going to be a lot of information, it's not just a routine visit that we're having, that second individual can also hear what we're talking about in the clinic setting, but they may also come up with some very good questions themselves that the individual may not have thought of.
What role does attitude and humor play in dealing with MS?
I've worked in this field for a number of years, and I can tell you that those individuals who embrace the change that has occurred for them and try to empower themselves with as much knowledge as they can and try to keep things certainly as positive as they can, absolutely do better. I think that sometimes we need to laugh at ourselves. We're not perfect.
When a person is feeling down about the diagnosis, why is it important for them to accept that their feelings are okay?
Well, I think one of the things that we like to talk with our patients about is there are emotional changes in multiple sclerosis, certainly directly related to the MS itself, but also those situations that are around them, just life. You're not going to be perfect at all times, and I think that when emotions, though, stay down for a number of days, you're starting to kind of separate yourself away from your family, other things that can go along with depression creep into the picture, it's time to talk to the healthcare team about this. I think that, you've got to realize that even at early diagnosis or later in the disease, as you're going through that disease course, you're going to have these emotions that are going to be kind of a roller coaster for you, not only for you, but for those around you.
I think that maybe in some of the people I've talked to, there have been almost self-inflicted wounds because they feel that why haven't I risen to this challenge?
Yes.
Yes. And you can't be hard on yourself.
You can't. And I think that that's where, if you're having a down day and you've got those positive influences around you, right. We say if you can take the negative out of your life, certainly try to do that. But right. if you've got somebody that can be positive, maybe when you're a little bit more down, mm-hmm. then you can pull from that good energy and they can help bring you up. And it's the kind of thing, too, if you're staying in that down state, then it's time, certainly, your family, your significant others, but letting that healthcare team help you move through those symptoms.
How have you seen research or medical advances for relapsing MS change over the course of your career, and how has that given you hope?
I've reached that age in my career that I can say I actually was practicing in a MS clinic prior to any of the disease-modifying therapies being made available. Our first medication for multiple sclerosis that was FDA approved was 1993. We have many other treatment options at this point, and I think that even though our patients sometimes, they think about, okay, well, this is going to be a regimen I'm going to have to do potentially for the rest of my life. But, you can say we have hope that we are going to have even better medications. So I think that offering that hope to patients, and if one medication maybe doesn't work for them, then there are other things that we can look as options for their health care.
I'm very optimistic.
I am too.
I'd like to thank Beverly for spending time with us on this episode, and thanks again to Leslie. We've come a long way since the days when my father was diagnosed with MS. Today, there are FDA-approved treatment options that are helping to impact the lives of people with relapsing MS. Receiving a relapsing MS diagnosis is a life-changing event. Finding the right treatment and medical team are important steps in taking action to help manage your disease. Thanks for joining me. I'll see you next time on Take Action on MS.
Aubagio, teriflunomide, is a prescription medicine used to treat relapsing forms of multiple sclerosis, MS. Important safety information. Do not take Aubagio if you have severe liver problems. Aubagio may cause serious liver problems, which can be life-threatening. Your risk may be higher if you take other medicines that affect your liver. Your healthcare provider should do blood tests to check your liver within 6 months before you start Aubagio and monthly for 6 months after starting Aubagio. Tell your healthcare provider right away if you develop any of these symptoms of liver problems: nausea, vomiting, stomach pain, loss of appetite, tiredness, yellowing of your skin or whites of your eyes, or dark urine. Take a medicine called leflunomide for rheumatoid arthritis. Are pregnant. Aubagio may harm an unborn baby. You should have a pregnancy test before starting Aubagio. After stopping Aubagio, continue to use effective birth control until you have made sure your blood levels of Aubagio are lowered. If you become pregnant while taking Aubagio, or within 2 years after stopping, tell your healthcare provider right away and enroll in the Aubagio Pregnancy Registry at 1-800-745-4447 option 2. Are of childbearing potential and not using effective birth control. It is not known if Aubagio passes into breast milk. Your healthcare provider can help you decide if you should take Aubagio or breastfeed. You should not do both at the same time. If you are a man whose partner plans to become pregnant, you should stop taking Aubagio and talk with your healthcare provider about reducing the levels of Aubagio in your blood. If your partner does not plan to become pregnant, use effective birth control while taking Aubagio. Aubagio may stay in your blood for up to 2 years after you stop taking it. Your healthcare provider can prescribe a medicine that can remove Aubagio from your blood quickly. Before taking Aubagio, talk with your healthcare provider if you have liver or kidney problems, a fever or infection, or if you are unable to fight infections, numbness or tingling in your hands or feet that is different from your MS symptoms, diabetes, serious skin problems when taking other medicines, breathing problems, or high blood pressure. Your healthcare provider will check your blood cell count and TB test before you start Aubagio. Talk with your healthcare provider if you take or are planning to take other medicines, especially medicines for treating cancer or controlling your immune system, vaccines, vitamins, or herbal supplements. Aubagio may cause serious side effects, including reduced white blood cell count. This may cause you to have more infections, numbness or tingling in your hands or feet that is different from your MS symptoms, serious skin problems, breathing problems, new or worsening, and high blood pressure. The most common side effects when taking Aubagio include headache, diarrhea, nausea, hair thinning or loss, and abnormal liver test results. These are not all the side effects of Aubagio. Tell your healthcare provider about any side effect that bothers you. Consult your healthcare provider if you have questions about your health or any medications you may be taking, including Aubagio. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including boxed warning and medication guide, available on www.aubagio.com.